Welcome to Mentality. I'm Dr. J. Thomas, and today we have the distinguished Dr. Ernest J. Barthelemy, Chief Neuroscience Officer and Global Health Strategist. Today, our topic will be the brain-heart connection. And Dr. Barthelemy, thanks for being with us.
Thank you for having me. It's a great pleasure to join you again, Dr. Thomas.
The pleasure's all ours. Dr. Ernest J. Barthelemy is the Division Chief of Neurosurgery at the SUNY Downstate Health Sciences University in Brooklyn, New York, and the founding president of the Society of Haitian Neuroscientists. A Brooklyn-born Haitian-American New Yorker, Dr. Barthelemy obtained his MD and neurosurgery residency training at the Icahn School of Medicine at Mount Sinai. From 2017 to 2019, he was a Paul Farmer Global Surgery Research Fellow at Harvard University, where he also completed a Master of Public Health degree with concentrations in global health and public health leadership at the Harvard T.H. Chan School of Public Health. As a scientist, his research focuses on advancing global health equity and improving outcomes in populations that are disproportionately burdened by acute neurosurgical disorders. Dr. Barthelemy also sits on the Global Health Task Force of the International League Against Epilepsy and is the 2021-2023 co-chair of the Young Neurosurgeons Forum of the World Federation of Neurosurgical Societies. Again, it's our pleasure to have you, and let's jump right into it. Brain-heart connection. Please advise.
Absolutely, yeah. This is, it's, I always find it humbling to speak on a topic that is so much larger than I am, or even my field of practice. It's important to say, Dr. Thomas, as you know, and as our viewers may imagine, nothing I'll state today necessarily reflects the opinion of my employer, SUNY Downstate. So I'm speaking purely independently and from the perspective of my position here at Mentality. With that said, I will share a little more about my background that I don't often get to share in my bio, which is that, as you know, prior to my medical career, I had two interesting preceding careers. I was a professional dancer for several years, and later on pivoted towards a career in fitness and wellness. And I obtained a master's degree at Columbia University in exercise physiology and motor control. And that has, that phase of my career, particularly the phase of my career in fitness and wellness, provided me with great insight that enables me to bring additional perspective to this brain-heart connection conversation. That I would argue a lot of my colleagues don't get to enjoy and could use, because we have a crisis of burnout in probably all major professions, certainly in medicine, even before the whole COVID pandemic. And the whole COVID pandemic, really moved us into a new sphere of concern about physician burnout. As it did for the rest of the world's population. So all of this is very, apropos to the current time, even as we hopefully move beyond that pandemic's effect on our mental and physical health and well-being. So I say the topic is large because the brain and the heart are two very important organs, and we have people, just speaking from the medicine realm, there are multiple specialties focused on specializing in just one of those organs. And I thought to myself, for today's talk, what would be the kind of panel that would bring all of the top relevant medical expertise together to talk about these organs from a scientific perspective, which we're not going to dive deeply into, but just to give our viewers a sense, there are at least 4 specialties. So you're talking about people who are, fully blown professionals in their respective medical specialties who can, speak from the perspective of what they do on a daily basis. You have and let's say 5 specialties. The clinical neuroscientists, so that's neurosurgeons like me, or neurologists who are the medical branch of our field who don't do surgery. So that's, 1 or 2 fields. There are the endocrinologists who are the hormone specialists, and they have a very important role in this conversation. There are the cardiologists, and we can even go more broadly and say the vascular specialists, which is actually adding 2 specialties. So I started talking about 3, 4, we're moving on to 5 or 6 cardiologists and vascular surgeons. So the whole world of doctors and surgeons, physicians and surgeons who specialize in circulatory health, vascular health. They obviously have a big role in this brain-heart connection conversation. And then psychiatrists have a huge role in it, right? So the topic is a big one with many different areas. And one of my hopes for our conversation today is that our viewers, wherever they are, they may be practitioners in one of these fields. Many of them are likely either patients in one of these fields or family members of people who are patients in one of these fields. So at the very least, we can consider that there's some place for everyone in this conversation, and we want to leave people with something useful. Okay, and so that's my hope for this. And so the reason why all of those specialties are engaged you can think of the brain-heart connection from at least 3 very important perspectives. It's not limited to those 3, but I want to offer 3. One is vascular health, and let's make that a very big theme because it's so important for mental, physical, and emotional health. So there's the vascular health, which I'll talk about first. And then there is the endocrinological health, which I'll also talk about, closely related to the vascular. And then there is the mental and emotional health component, okay, which we can address. And Dr. Thomas, I can speak endlessly, so I'll pause at moments, and I'd love to take questions so we have some interaction about this. Okay.
My first gleaning is that you just made sure that no practitioner in the field is neglected. That's my first gleaning. The endocrinologists per se, and those that are in the vascular field, you've included that. And I said, I didn't think about that, but that is so much a part of the brain-heart connection. That's my first thought. So
yeah,
please.
Yeah. You're well. Yeah, no, thank you. And it's an excellent thought. From the global health perspective. So as a global health scientist, I think a lot about, what are the health concerns that are killing most people in the world, whatever country you're in. And I'll tell you, we have pretty solid data from high-level sources like the World Health Organization. They have a study called the Global Burden of Diseases Study. It looks to see what are the main diseases that are burdening people and societies around the world. And I'll tell you that the data from that study for decades makes it very clear that the number 1 and number 2 killers of people around the world for years and years and years are 2 conditions: heart attack and stroke.
Incredible.
Very, very clear.
Heart connection on the dark side.
That's right. That's exactly right. And on the dark side, I love that you put it that way, because this is one of our limitations in medicine, actually, in our desire to address health, is the way we are trained as physicians. And it is helpful that we're trained that way, but it's limiting, is we are trained in a disease-focused manner, not in a health-focused manner.
Exactly.
There's a minority of us who really are thinking proactively and constantly about health, and the optimization and maintenance of health. Some of our primary care practitioners are preventive medicine folks, sometimes occupational medicine and health, which is a tiny slice of the world of medicine. There are a lot of primary care doctors, but even the primary care doctors, we're dealing with our many, many sick patients. And so our training in how to, manage sickness and illness, and the rare instances where we can curing illness, is how our education has been oriented, but to the neglect of things like nutrition and exercise, which in any medical curriculum is a tiny, tiny slice of what we're studying. Even less so things like the benefits of meditation or meditative practices, which I would say don't even have a role in most standard curricula. Despite the fact that we talk about meditation, and I'm a meditator, even more so recently, has well-documented evidence that it can prevent heart disease.
Incredible.
Yeah, there are meditative practices that optimize blood pressure control better than blood pressure medications.
Incredible.
Yeah, it's very interesting. And one of the reasons why that is the case points to the anatomical connection between the brain and the heart. And there are two major ones: the vessels themselves, the blood vessels. So, how the brain, which needs a tremendous amount of blood to find the oxygen it needs to function, right? The brain is responsible for who we are in many respects, what we do, our ability to speak, the ability for you and me to have this conversation, right? We've got our Broca's area of the brain formulating our words, letting us articulate what we're saying in the language that we choose. And you and I both have a few languages to choose from, right? So we're going to the parts of our brain that are letting us articulate what we're saying. So we're in the Broca's area, in the frontal lobe, and a little bit further back around in the higher upper banks of our temporal lobe, and I won't get too detailed here, okay, considering our audience, but we've got another area that is receiving the information, interpreting the sounds, making sense of the words, right? Like that, and everything else, any movement, right? If I make a gesture, if I lift a hand, or lift a finger, right? There's a lot that my brain is doing to make that movement happen. That movement is starting in my brain, and my brain is sending signals down my arm to lift my hand up, right? So all those connections. This is why one of the symptoms of a stroke can be loss of the ability to speak normally, or sudden weakness, inability to lift a hand up like this, right? If this happens to anyone, or this happens to someone around anyone, you should call 911 immediately to get that person to an emergency department, because they could be having a stroke when they have sudden weakness on a side of the body, or sudden change in their speech, okay? Or a sudden loss of sensation. That is an indication that the region of the brain that does what they are attempting to do, lift up that arm, express what they're expressing, that region is not getting the oxygen it needs to function. So it's basically suffocating. Why is it suffocating? Because there is some blood vessel whose job it is to bring blood from the heart to the brain, and that blood vessel has now been blocked by something.
Mhm.
And so now the blood is not getting through in a sufficient manner to fuel that region of the brain to complete the action. And so the reason why it's so important to call 911 and get that person to an emergency department is we are now in a world, if you're fortunate enough to live in the US, for example, and not even everywhere in the US, but in a high-resourced part of the US with good health systems, we have the ability to treat and sometimes cure this blockage of an artery feeding the brain and open it up so that that blood can get where it needs to before that region of the brain dies. It usually won't die immediately. It'll suffocate. Okay. So we call that an ischemic stroke. Okay.
So, doctor, you're saying that the effects of the stroke are reversible in some cases, per the word cure.
That's exactly right. And I would say in the vast majority of cases, there is a strong possibility to reverse the effects of the stroke if it is diagnosed quickly enough, because there's a window of time. It's a suffocation event. I use that term deliberately because if you think about suffocation, it's not the kind of thing, we know there's a lot of pain and suffering associated with the idea of suffocating. And at the same time, it's the idea that the person who has just started suffocating, right, is not dead. They are in a process that will lead to death if there is not some intervention that eliminates the suffocation. Well, we now have some tools to do that in neurology and in neurosurgery, including medications that can open up blood vessels. And then now we have sophisticated techniques where we can actually put catheters and wires inside of the blood vessels that connect the heart and the brain and pull the blood clots out. We call that a thrombectomy. But there are limited windows of time within which we can safely do that in most patients. And with the clot buster types of medications, we're usually talking about somewhere between 3 and 4.5 hours after the event begins. That's our window.
That's a nice window.
It is, if people take action. But sometimes, and unfortunately more than sometimes, for a variety of reasons, we don't want to get ourselves that healthcare attention. Maybe we're embarrassed that all of a sudden the words aren't coming out the way we want to, or we're trying to shake off that arm to think, okay, whatever this is, let me just wait. Let me just wait for, things to kind of go back to normal. All right. And then by the end of the day or the next day, maybe the time when we finally decide, okay, this is not getting better. Let's get ourselves to the hospital. Okay. And then by then it can be too late for any of the interventions that can reverse that. So now it's just making the best of a very bad situation, preventing another one from happening. Same thing for a heart attack. How many people get some chest pain or pressure or discomfort and really don't want to deal with the trouble of getting themselves to an emergency room. But the heart and the brain are the same in the sense that time is heart, time is brain. Okay. And the longer we take to get the attention when we're having an acute episode like this, the more damage we do to the tissues, okay, the stuff, the muscle, or the spongy tissue that make up the heart and the brain, respectively. Okay.
We find that people perhaps, and you'll keep this thought honest, doctor, have an aversion to medical intervention because they fight the new knowledge that they are having an episode, be it a heart attack or stroke, with the old knowledge that everything's okay.
That's correct. The idea of everything being okay is, on the one hand, an important part of our mental health daily. On the other hand, it does pose a certain risk for us to believe
Mhm.
that life is certain.
Exactly. Nothing can go wrong.
Nothing can go wrong. I think one of the sources, and some of the modern thinkers and philosophers that I learned from, and there's a great handful of those. I recall one of them suggesting that one of our sources of suffering during the COVID pandemic
Mhm.
was that it threatened or eliminated the otherwise, and I'm paraphrasing, protective illusion
Mhm.
that life is predictable or
Mhm.
certain.
Mhm.
So COVID threw us into this face-to-face reality that was present even before COVID was there,
Exactly.
but that we were fooling ourselves into believing was not there. So
Exactly.
before COVID, most of us um, were into the idea that things were going to be as they always were,
Mhm.
right?
Well, it's hard to detach from that thought.
It is.
Mhm.
And I would offer that one way to uh, liberate oneself from that thought is to consider the power we all have to create the life that hasn't yet shown up.
Indeed. Indeed.
Yeah, yeah. Um, while it can be a great source of distress for us to realize that the future is not going to look like the past did, even though um, a lot of it does, and it is a survival mechanism for us
Mhm.
that our brains tend to have us expect that things are going to be the way they were. I mean,
Mhm.
by design, okay, if you will. I lose that term loosely. Uh, the way our brains are put together,
Yes.
we have these powerful memory systems, and they
Oh,
serve us in our
mhm.
survival, right?
Mhm.
I walked around that corner, something really, really threatening happened. So next time, I'm not going to walk on that side of the street because something really bad
Exactly.
can happen, whether or
Exactly.
not it's going to happen, right?
Yeah.
So just an example of it's a protective mechanism.
Mhm.
And it also can be our um, metaphysical prison
Exactly.
because it can fool us into thinking that things can't be some other way. Oh, the last time I dated such and such a person, this is what happened. So
Mhm.
I'm not going to date that kind of a person anymore because I know what's going to happen.
In the realm of the mentality, we speak of that as the repository. Um, and within that repository of the subconscious, there's a part that serves a particular function, a particular job. And the subconscious has the maturity level of a 10-year-old. So right or wrong is not as subjective um, in an adult life as it is for uh, a 10-year-old or so. These anchors that we speak of, uh, it keeps us uh, kind of measuring our steps by those particular chains that hold us, uh, could be a blessing or a curse that need to be redressed.
That's absolutely correct. And um, my training in mental health is limited,
Mhm.
and I would expect, knowing what I know of your history and preparation professionally, you probably have a bit more insight into the mental health realm. But one of my dear friends, or not but, and one of my dear friends, a psychiatrist um, with whom I enjoy having conversations like this, um, offered the compliment that for a neurosurgeon, I was a pretty psychological neurosurgeon who um, takes time to reflect on the psychological realm and its impact on health matters. And so that does enable me to appreciate this repository concept and the anchors that come from it. And I'm going to use that example of yours, Dr. Thomas, of the repository that anchors our decision making, which springs forth from often experiences that happen as young children, to step into the endocrinological realm of the brain-heart connection. Okay, since hopefully our viewers have picked up on the very intimate vascular link between the heart and the brain, both susceptible to the same kinds of disease and actually physiologically connected with the heart bringing blood to the brain. Before I get into this endocrinological realm, let me give one more connection that actually lives a little bit on the vascular side. I didn't even speak about the neural connection between the heart and the brain. I spoke about the vascular one, the blood, because there are big blood vessels that go from the heart to the brain and the brain to the heart. The carotid arteries bring blood from the heart to the brain. The jugular veins bring blood from the brain to the heart. It's very, very important. This is an actual loop. It actually is a heart-brain, brain-heart loop. Okay. So these are real connections, but there are others. And the vagus nerve is an extraordinarily important nerve that directly connects the heart and the brain. What is the vagus nerve? And this is going to be a perfect way to segue into the endocrinological realm, okay, which is the realm of the hormone-related connections. So one of the ways we conceptualize the nervous system, okay, so nervous system is the heart, the brain, and all of the nerves that emanate, not the heart, excuse me, the brain, the spine, and all of the nerves that emanate from the brain and the spine, the peripheral nerves, okay? I go into the fingers and the thighs. So for any viewers who are unclear about what I mean about peripheral nerves, as a neurosurgeon, my practice is primarily focused on operating on diseases in the brain and the spine. So I'm a brain and spine surgeon. And some time ago, I had a patient at the trauma center where I work who was stabbed in the thigh. And that patient's foot became paralyzed from the stab in the thigh. So that new weakness was not a brain or spine problem. That was a problem with a nerve further away. That was a big nerve in the thigh. Actually, the biggest nerve in the human body is the sciatic nerve. And that is the nerve that brings all of the nervous system energy from the brain and the spine down to the foot and the toes, so we can lift our feet or stand up on our toes. So those peripheral nerves bring that energy, that information down to the foot and the toes, so we can do those movements. So his brain was fine, my patient, and his spine was fine as well, but his nerve was severed by the stabbing. So with the help of one of my colleagues in orthopedics, who, when we took that patient to surgery, opened that leg up, moved the muscles aside to expose the nerve that had been transected. I did what I needed to do and brought in a microscope, and I repaired that nerve, and sewed it back together. It's a peripheral nerve. Okay, so neurosurgeons are trained to deal with nerves in the body wherever they are. So one of these very important nerves is part of a division of the nervous system we call the autonomic nervous system. So the autonomic nervous system is the branch of the nervous system that drives our hormones. Okay. So once we're talking about hormones, we're talking about endocrinology. Okay, the study of hormones or chemical messengers that our brain moves into the blood to either directly impact how many vital organs are functioning, and or to influence other organs that then have their hormones that they secrete into the bloodstream, okay, to control what's going on in the rest of our body. So the two main branches of the autonomic nervous system are the sympathetic and the parasympathetic. So without turning this into a medical school class, the last I'll say about this is that when we're talking about the sympathetic, okay, despite the idea or sound of sympathetic as something soft, that actually is the fight or flight branch of the nervous system. So of the autonomic nervous system. So when a well-meaning friend is sort of hiding behind something and then jumps out and says "boo," or a pit bull all of a sudden that we didn't see starts barking, right? And we do what we do, which is either we run or we jump or we fight.
Yes.
Right? Well, the process that gets our body and brain ready to do all those things, that process starts with a secretion of hormones that gets our heart racing. And we can feel it. We feel our heart pounding in our chest, our eyes wide open, our pupils, okay, the dark black parts of our eyes, they get very wide. Okay, and there are all these very anxiety evoking, okay, experiences that happen. It's stress. These are stress events.
Some folks call it adrenaline.
Adrenaline is the main stress hormone of the sympathetic nervous system. That's right, and we call it adrenaline because the adrenal glands that sit on top of the kidneys are stimulated for the production of that hormone. Their stimulation is coming from the brain. Okay, so now we are in the endocrinological realm. And then this endocrinological realm is going to let us step into the mental and emotional health realm. Okay, because while we create these divisions, because they enable us to understand a very, very complex phenomenon that our brains couldn't comprehend if we tried to take it all in at once. So we have to sort of break them up and classify them. So that's it. That's it. What we know in learning and memory science, that emotion is a very powerful anchoring agent for memory. So things that occur when we are in a peak state of emotional stimulation, we remember very easily. We don't struggle. When we're in the opposite of a peak state, when we're very bored, we're down, quiet, struggling to stay awake, pay attention, we have more trouble remembering those things.
Exactly.
But in a peak state of stimulation, and that stimulation can be positive or negative, exactly. We remember in great detail what was going on. This is likely one of the enabling features in law enforcement of what has victims of crimes able to describe in great detail the criminal, so that our law enforcement professional artists can almost perfectly render the picture of that individual, because that victim, who was in a fight or flight state when the victimizing event was occurring, their brain is wired to remember very, very, very precisely exactly everything that happened and what that person looked like. Shows you how powerful the brain is when you see how exact those drawings can be. Right? as well as the talent of the artist involved. So all
Yeah.
of this to say, Dr. Thomas, to come back to your example of the 10-year-old, that when this, when we have these stress-inducing events happening, and the region of our brain called the hypothalamus, okay, which is a tiny little organ that sits right at the base of our brain. Actually, the hypothalamus sits a little higher in front of the pituitary gland, and they're related. So the hypothalamus and the pituitary gland, their stimulation, which then moves down pathways that link the brain to the adrenal glands. So we call this the HPA axis, the hypothalamic pituitary adrenal axis, okay, that produces the adrenaline responsible for this fight or flight response. Okay. When we have events like that occur at a very, very young age, they are events that can construct defining character, personality, and behavioral patterns that are with us for the rest of our lives, and the influence of which we may not even be aware, but they're there.
In that repository.
That's it, in that repository. And with the exception of very powerful interventions that allow people to discover the contents of that repository and to work with it and to liberate themselves from it. Interventions like, the powerful methods of our psychoanalysts, or the powerful hypnotic interventions of our master hypnotists like yourself, Dr. Thomas, right? Interventions like this that allow us to reach deeply into that repository, discover its contents, and figure out some of this invisible hand that is guiding the choices we make, okay, that might be getting in the way of our ability to advance professionally, personally, okay, or deal with our limitations. We may fool ourselves into thinking there's no other option. This is how it's got to be. Well, because we learned this powerful survival mechanism at a time when we were threatened while our very young brains were developing, and we anchored the memory of that deeply with the emotional state of a stress response. Okay, that is the opposite branch of the nervous system from the parasympathetic branch of the nervous system. What is the parasympathetic branch? Well, if the sympathetic branch of the nervous system is the one giving us the adrenaline, the anxiety, the fight or flight, or freeze. Some people say freeze. That's another possible anxiety-evoking reaction during a time of stress. Well, the parasympathetic is the rest and digest branch. That's an altogether other experience. That is the one that is relaxing. It's slowing things down, figuratively and literally. It actually slows the heart down. Okay. And slowing the heart down is one of the tools we have at our disposal for living a longer, healthier life. Let me get into this piece a little bit, because it'll offer our viewers something for their health. And this is coming from my exercise physiology days. Okay. Beautiful. So regular exercise, which remains perhaps outside of the complex world of nutrition, the single most powerful intervention at our disposal for optimizing our health, fitness, longevity, and wellness. It's still underutilized. But I'll tell you that our pharmaceutical professionals who are working, particularly in the field of blood sugar managing and diabetes managing and other heart disease managing medication, they know that the holy grail, what they're trying to get into a pill, is the benefits of exercise.
The benefits of exercise.
They still can't do it.
Mhm.
They got really close with metformin,
Ah,
really, really close.
mhm,
And I will leave that for maybe another day. Maybe we have an
sure.
endocrinologist
Mhm,
or someone else who can talk about metformin and why not only people in the diabetes managing and preventing realm are interested in that particular drug, but
mhm,
also why a lot of anti-aging and longevity promoting professionals are also interested
mhm,
in that drug, which in some studies seems to uh, at least statistically, result in people who take that drug living longer than people who don't, that may not even have had blood sugar disorders. So that's a whole other interesting thing.
touching on cell regeneration.
Um, Perhaps, I mean, among other mechanisms, which is
Mhm.
a whole other space, which we should bring in some people to
Sure.
unpack that, because this is an area that I'm also very interested in.
Sure. Let's do
Um,
so.
but I'll tell you, it's still not exercise. Still not exercise.
Yeah,
And
substitute.
exactly. And what's so great about exercise, and there's different ways to exercise.
Mhm,
Let's talk about cardiovascular exercise, which the
mhm,
easiest way to do that is to walk, right?
mhm,
Walking, good, nice, 20 minutes of walking every day will have a transformative impact on people's health.
mhm,
Okay. So one of the benefits of cardiovascular exercise, um, and by the way, more intense versions of it can even do more. So if walking does what it does, running will
mhm,
do something even more powerful. It'll start to stretch over into some of the anxiety controlling things that we were referring to. But the reason why cardiovascular exercise is called cardiovascular exercise, we think of it as cardio, and we know it speeds the heart up
right.
when we do it. Um,
Mhm,
but what is it about speeding the heart up that is good for the heart? It's not what's happening during the exercise.
mhm,
It's how our body responds in adaptation to
mhm,
the dosed stress of
mhm.
exercise.
The dose.
Exercise is dosed stress. So what we're
Mhm,
doing is we are deliberately delivering a dose of stress to the
mhm,
human body
mhm,
to take advantage of its ability to adapt
mhm,
to stress. So we are in many respects preparing it. We're saying, here is some stress. I want you to get good at
mhm,
managing this stress when it comes. So the adaptation of the heart over
mhm,
time, when we dose it with the stress that speeds it up
mhm,
and that asks it to quickly deliver blood
mhm,
to working muscles all over the body,
mhm,
the heart does two things. Number one, the muscles of the heart start to stretch in a way that they become more flexible.
mhm,
Okay. So the heart can stretch in healthy ways and in unhealthy ways. When it's unhealthy, it can lead to heart failure, okay, which can contribute to poor health.
mhm,
Healthy heart stretching, which only occurs really with the right exercise dosing,
mhm,
lets the heart fill with more blood per beat than it
mhm,
used to be able to.
mhm,
And with that stretch comes a very powerful contraction as well. So you have
mhm,
flexibility and strength of the heart muscle filling with blood and
mhm,
then, recoiling to powerfully squeeze that blood out. And a heart that's getting fitter with
mhm,
exercise is now sending more blood per beat to
mhm,
the brain, the muscles, the digestive system, the legs, everything in our body that needs oxygen from the blood to survive. So that heart that is now delivering more blood, more nutrients, more of what we need per beat, it
mhm.
doesn't have to beat as often.
Is that what they call a runner's pulse?
That's right. So when I have a patient in the hospital for whatever reason,
Mhm,
um, there's a couple of flavors of what we call bradycardia. Okay.
mhm,
So bradycardia is a pulse that is less than 60 beats per minute. Okay.
mhm,
Um, so so a normal pulse is usually going to be somewhere in the range of 60 to 80 beats per minute.
mhm,
Okay.
mhm,
Um, when the pulse is getting up to the 90s, it's it's a bit fast. And then when it's at or higher than 100, that is what we call tachycardia. That is
mhm,
too fast um, for someone who's at rest, not doing anything to
mhm,
trigger that kind of a fast heart rate. Okay. Um, conversely, bradycardia, brady means slow,
mhm,
okay? Bradycardia, so slow heart rate,
mhm,
um, can mean a couple of things. If I have a patient with a heart rate in the 40s, this could, if and I look at this patient and I see what I'm dealing with is a patient who is very out of shape, who
mhm,
has been smoking, okay,
mhm,
and has even the physical changes to one's body that come with smoking.
mhm,
Someone who has been abusing of alcohol, or someone who has been abusing of their nutrition, haven't been eating a supportive diet, just haven't been taking care of themselves. And then
mhm,
that person's heart rate is falling into the 50s or 40s. That's someone who may be on the way to a life-threatening heart attack.
mhm,
And so, we pay attention to that. And then if it's 30s, typically we are calling a code. We're trying to rescue that person. We're considering that that is someone, and usually you can see on their EKG, their electrocardiogram, that that slow
mhm,
heart rate is coming with some very abnormal electricity moving through the heart. And
mhm,
we've got to do something to keep that person alive because their heart is dying.
mhm,
There's another brand of patient that has a pulse that can get as low as the 50s and 40s, and rarely slower than that.
mhm,
It's the patient who's in the hospital with that heart rate, and they are the picture of health,
mhm.
right?
What causes that?
Well, that is the runner's pulse.
Mhm, mhm,
And every time I've had a patient like that, and you may ask, well, why we're in the hospital? Well, because healthy people are people who take care of themselves, and sometimes they find themselves in the hospital for something. And
mhm.
every time, almost every time, it's a very short stay. They're not going to be around the hospital for a long time. They're going to get what they need handled and get out.
Okay,
Okay. That's the
okay,
best way
but
to interact with a hospital if you need one. Get into
mhm,
one as soon as you can and get out of it as soon as you can. That's that's
exactly,
that's the key. That's the key.
exactly,
What you don't ever want to do is go into a hospital and stay. Okay.
exactly, exactly,
All right.
exactly.
What causes that is this phenomenon that I'm talking about. So when I've had patients like that, picture of health, heart rate is
Mhm,
40, 48. My
mhm,
first question to that person is, do you run? And I'll get answers like, well, I've run 7 marathons, but I wouldn't say, you know, or um, yeah, I run about half an hour to an hour every day,
mhm,
5 or 6 miles every morning, and then
mhm,
I don't give it a second thought, and then we're all okay. We're like,
mhm,
this is not a heart that needs to be rescued. This
mhm.
is this is a heart that's not going to be having any trouble for a really long time.
Exactly,
That
exactly.
that that is what we're seeing. That is that runner's pulse. Um, and a way to think about um, why that's so phenomenal for that person's health, when you
Mhm,
talk about their heart, is, as I said, the heart that's getting the flexibility to hold more blood and the
mhm,
power to move more blood per beat.
mhm,
Think about it mathematically. How long will it take that heart? Let's say there's a finite number of beats that one gets in one's lifetime.
mhm,
And, you know, let's say, and I'm completely making these numbers up.
mhm,
Let's say we all get 3 million beats.
Mhm.
That's all we get. Well, the heart that is beating up in the 80s and 90s on a regular basis per minute,
Mhm.
80 to 90 beats per minute,
Mhm.
and getting only so much blood to the body's organs per
Mhm.
beat, is going to get to their 3 million beats much, much faster.
Then one that runs for a half hour or an hour, and then have the runner's pulse.
That's right. That runner's pulse, if that person, that person's heart rate is literally running at half the rate
Mhm.
of the person whose heart rate is not. So it's going to take them twice as long to get to their 3 million beats. That's a lot. That's a lot more life to live.
So though a person run or do the cardiovascular piece that accelerates the heartbeats, afterwards, there's an overcompensation of lesser beats with the runner's pulse, per se.
That's right. You got it. That's right. Because it's a fitter heart. It doesn't
Mhm.
have to beat as much to do its job. Its
Mhm.
job is to get oxygen-rich blood to the rest of the body.
And when
And
it beats a lot, it beats a lot it beats a lot with comfort because it is accustomed, it has been exercised for that, as opposed to beating a lot out of stress and strain.
that's correct. It is beating a lot during that brief dose
Mhm.
of exercise,
Mhm.
brief dose of deliberate stress on
Mhm.
purpose to to teach the heart what it needs to adapt itself for. If
Dr.
the heart,
Dr.
it's not,
Barthelemy,
yes,
one question is the the physiological and the psychological uh, connection between the two. Once you uh, get a chance, could you speak about that? Because now the brain and the heart, strokes and heart attacks are probably lessened. And number two, um, the brain and the heart, the stress, the processing of stress is probably lessened also because there's more oxygen to the brain. At your convenience. Please finish your thought.
yeah, and we're gonna move right into it. We've already started touching on some aspects of it, even by evoking the term stress.
Yes.
We evoke the term stress in the endocrinological frame because we were talking
Yes.
about adrenaline,
Yes.
and I wanted to paint a nice broad picture for what the vagal nerve is.
Mm-hmm.
But yet we use the term stress, which already nods to the emotional realm,
Mm-hmm.
right? And I use the term anxiety
Mm-hmm.
for a reason. So the fitness of the vagal nerve
Mm-hmm.
is really key. And what is the vagal nerve? It is the nerve that brings the rest and digest parasympathetic power of the brain to the heart. So the heart rate slows down when the vagal nerve is stimulated.
Mm-hmm.
And the the fitness of the vagal nerve, the tone of the vagal nerve is increased in someone who's been exercising on a regular basis. Okay. Now, the emotional health and mental health realm
Mm-hmm.
is intimately related to this.
Mm-hmm.
One of the reasons why exercise is a known treatment for depression. It can be very, very effective for people who deal with depression,
Mm-hmm.
right? Um, is that exercise optimizes blood flow to the brain, tones the sympathetic nervous system, makes it more difficult to be stressed out because your body has increased its ability to deliver anti-stress hormones that calm us down. Uh, it optimizes blood flow to the regions of the brain
Mm-hmm.
that enable us to calmly deal with life, as it were.
Mm-hmm.
Um, in the emotional intelligence theory, which is becoming very, very popular, especially in our business and leadership development industries and ecosystems. More and more we're hearing about the amygdala hijack. What is that? Dan Goldman, who I believe is the neuroscientist who did a lot of work in this area and has popularized this with his books, he refers to the amygdala hijack as this region of the brain, the amygdala, which is found in the temporal lobe. The temporal lobe is somewhere, I always point to the temples, okay, to get that term temporal, because it really below the skull. The temporal lobe really does live right around where our ear is, and all the way to the side over here. And then on the inner side of that temporal lobe, there is this almond-shaped part of the brain called the amygdala. Amygdala comes from, I believe, the Greek term for almond. So the amygdala has a major role in fear. So in situations where one is challenged by the experience of stress or a perceived threat, what we're dealing with is the experience of fear, which is tightly linked to the fight or flight stress response, if you will. The amygdala hijack that he refers to is when our behaviors are driven by the amygdala. Okay. The last nod to the psychiatric realm, and if we have a psychiatrist come, and I'm sure we will sooner or later. Both of us know several.
Yes,
okay,
indeed.
who can speak more to this.
Yes.
They can take us even further to talk about disease entities like post-traumatic stress disorder as one of the very important diseases that helps us understand the function of the amygdala as a fear-related organ, because it plays a major role in modulating the stressful experiences and flashbacks of people who suffer from post-traumatic stress disorder. So the amygdala is an organ that sort of mediates or modulates fear responses, and can also take us out of our right mind, if you will.
Incredible.
Okay.
Nope.
Now, when I say right mind, because I want to complete this concept, very important for the concept of emotional intelligence. I'm not referring to the right side of the brain.
Right.
I am referring to the part of our brain that enables us to heighten the restful contemplation, the thoughtful compassion, consideration, the sort of humane sphere of social interaction that is controlled by the prefrontal cortex. So the prefrontal cortex of the brain, so pre means in front of, so in front of the frontal portion. So in other words, the part that is most in front of our brain, okay, right behind our forehead, which is the frontal bone.
Yes.
So behind the frontal bone, there's the frontal lobe, and the most in front of area of the frontal lobe, we call that the prefrontal cortex. That's the area that we want to be active when we are dealing with a potential stress or the perception of threat, to help us, for example, recognize that this threat is not a real threat on our lives. It is a situation that may be triggering the experience of threat for some reason, and we can recognize it for what it is and choose responses outside of our repository.
Exactly. Rational responses.
That's right. That's right.
Balanced in proportion.
Exactly. If we are acting from an amygdala hijack, then we are bypassing the prefrontal cortex and we're being driven by this fear response related behavior. And that behavior tends to be relatively irrational because that fear response is going to drive us right down that fight or flight response.
Exactly.
Fight, flee, or freeze. This is the, fight, flee, or freeze. This is either defensiveness or, backing down, the fleeing, the freeze, silence. We cease to communicate in a thoughtful, compassionate, contemplative way that tends to feed a relationship. So we may not communicate at all, or we, in our attempt to communicate, we're driven by fear. And so we do something that's more destructive than we might have intended. Okay, so the whole emotional intelligence framework and theory gives us a very powerful way to think about where does the mental and emotional health realm live in this brain-heart connection, in this brain-heart loop. And I'd say that, the amygdala versus prefrontal cortex paradigm is one very important way to think of it, and there are so many others.
That's one way that is turn your attention back to the prefrontal cortex in lieu of this niggling piece
amygdala. Exactly, that almond, you got it.
Which is pretty interesting because, again, like you said, with PTSD, one would tend to digress to something that is familiar. And I use the term sensitizing event, something that is, you have the initial sensitizing event and you have the symptom causing event that leads to the same response that was initiated during the initial sensitizing event. And if it's a fight or flight, then that almond controls it in a way that is unbecoming to the individual.
That's absolutely correct. That's absolutely correct. I'm going to riff a little bit here because there's to make some more connections across our themes, if you will.
Sure, absolutely.
Because talking about the amygdala, remember, I'm not a psychiatrist, I'm a neurosurgeon, and so when I think of the amygdala, I mostly think of it in the context of epilepsy. And one of our fascinating surgeries, and this is not an area of surgery I tend to perform much as a neurosurgeon, but I had the privilege of training with masterful surgeons who did a lot of surgery in and around the amygdala. And there are brands of epilepsy. So for people who don't know what epilepsy is a disorder of the brain characterized by parts of the brain speaking to each other in a disorderly format. And it can cause a sometimes life-threatening event where parts of the body start to uncontrollably move, or people can actually lose consciousness and have simultaneous sort of repetitive pulsating contractions of their body or freezing of their body, staring out into space and not able to regain consciousness. It can come with tongue biting in some versions, some extreme versions of it. Urinary incontinence, loss of control over bladder function can come with it. There are many different kinds of seizures that can occur in people who suffer from epilepsy. And what's happening is these neurons in the brain that normally speak to each other in an orderly fashion for brain function, they are now speaking to each other in a disorderly fashion. So instead of a conversation between neurons, it's all the neurons are talking at the same time.
Argument, perhaps?
we can call it argument. That's right, exactly. There's no communication happening between neurons. It's just noise, and it's loud noise that's happening all at the same time, or in a particular part of the brain, or it can generalize so that all of the brain is involved in this very, very noise-making, argumentative frame.
Chaotic is very chaotic.
It is chaotic when it occurs. A seizure in the brain is electrically or electrophysiologically very similar to an arrhythmia in the heart. The heart and the brain are both organs that are animated by, enlivened by electrical energy. Okay, with electrolytes sort of mediating that movement of a current. And the heart and the brain both function normally when there is an orderly movement of that current. When there is a disorderly movement of that current, it's sort of like those organs are electrocuting themselves, if you will. And they can cause great disability and death in both cases. Okay, and so there are many disorders in epilepsy tend to focus in the temporal lobe of the brain, and one of the surgeries in the area of neurosurgery where we can treat epilepsy, and by the way, surgery is the only means we have for curing epilepsy right now.
Sure.
Right. Not all epilepsy can be cured, but where epilepsy can be cured, surgery is the only way that we have to do it. And the reason why is because neurosurgeons who specialize in this or subspecialize in this area of brain surgery, when we have all the tools in place to identify where in the brain the epilepsy is coming from, where it's causing, we can remove those parts of the brain and restore normal function to that patient, which is a reminder that we are not our brains.
Exactly.
Okay, we are not our brains, but we do use our brains. We do use our brains. So amygdalohippocampectomy is a surgical procedure whereby the amygdala and its closely related hippocampus are surgically removed for the treatment of epilepsy. And the reason I wanted to bring this up is to introduce the idea of the hippocampus, because we've been talking about the amygdala, but we should recognize that both anatomically and functionally, the hippocampus is another part of the brain that sits right next to the amygdala, and they work very closely together. And this is important because the hippocampus is the organ, or the, let's say, the part of the organ of the brain that has taught us most of what we know today about memory. The hippocampus is that very key memory storing part of the brain. And certainly it doesn't work in isolation. There are whole tracks and systems. The limbic system is often talked about, okay, with a lot of neurons moving in and out of this hippocampus and assisting with this memory creating, memory storing, and memory retrieval process. So there are broad connections throughout the brain involved in creating memories and retrieving memories. The hippocampus is a very, very vital component of our memory capacity. And so even without being a neuroscientist, one can very quickly appreciate that if we've got a fear modulating structure like the amygdala sitting directly next to a memory creating structure like the hippocampus, so closely together that when they are affected by or have a role in the disease we call epilepsy, the surgical removal of both can be curative, then we can rapidly appreciate how memory creation and storage is a major aspect of what's happening when we experience fear. And the retrieval of a fear-driven memory is certainly one of the disabling characteristics of post-traumatic stress disorder. So that's why I wanted to introduce the idea of the hippocampus. And these are great things to take a little internet dive. You want to be careful about what you're reading on the internet. There's a lot of nonsense out there. One way you can, one can get more quality information. Let's use Wikipedia, for example, which is an internet encyclopedia, which has worked very well to store quality information. But we have to remember that a lot of nonsense can find its way into Wikipedia as well. So how do we get to the truth about what we're reading? Well, you can pull up an article in Wikipedia as a starting point, but I wouldn't focus so much on what's written in Wikipedia per se. I would look at what literature is it citing, because that's one thing it does, is it provides you with a reference list. And you want to bring more attention to articles that are well cited, and then go to those links. I mean, one great thing they did is they try to provide links to the articles that they are citing. And then oftentimes you'll find that those articles will be primary scientific literature that you can actually go pull up and
peer-reviewed.
And that's right. And then see what was being cited to provide information about these things. But these can be fun things to do thoughtful internet dives into to learn more about the amygdala, the hippocampus, their roles in fear and memory.
So I remember in one of our conversations, you spoke of how with epilepsy, there is a strand that leads to the heart from the brain that can be tuned, perhaps, for lack of a better term, loose term, that also relates to the heart-brain loop. Could you expound upon that?
Well, I want our viewers to know that we did not set up this interaction the way you just brought it out. I think all we're seeing is how phenomenal your hippocampus works. Okay.
It's just a little humble button up there, I think.
I get it. It's well, I don't know about little, humble maybe, but I wouldn't say little. And so the strand you're talking about, I've already named it. It's actually the vagal nerve. It's the vagus nerve.
There it is.
It's the vagus nerve. So in forms of epilepsy that we are not able to treat curatively by surgically removing a part of the brain, and that can be for many reasons. It can be because the disease causing the epilepsy involves too much of the brain, for example, and so it can't safely be removed without a devastating result in the patient. Well, we do have a device, and we have a growing number of devices, but one of the classic ones in epilepsy surgery is called the VNS, the vagal nerve stimulator. So what's interesting, and this is a surgery I do with vagal nerve stimulators, is this is one of the surgeries that is done for the brain. It's done for epilepsy, but the surgery is not in the brain. It is literally in the neck, in the highway between the brain and the heart. And what we do is we make a little incision in the neck, and it's an incision all neurosurgeons are very comfortable with, because it's the same incision we use for one of our classic spine surgeries. But instead of using that incision to get all the way back to the spine, we operate on a much more superficial area, which is right around the major blood vessels that I have already named, the carotid artery and the jugular vein. I mentioned that the carotid artery brings blood from the heart to the brain, and the jugular vein brings blood from the brain to the heart. So two big arteries. When we do surgery around them, we want to be very careful. So why are we going there? Well, when we're placing a vagal nerve stimulator, we have no interest in doing anything to the carotid artery or to the jugular vein. We just have to get there because the vagal nerve is tucked deep right in between those two.
Wow.
The vagal nerve that brings that parasympathetic energy from the brain to the heart, that energy that slows it down, it's tucked right in there. So we have to make this incision and then very carefully open up the sheath where those arteries live and dissect in between those arteries until we get to isolate that shiny, usually white or off-white colored vagus nerve. And then our vagal nerve stimulator has a coiled structure that we then physically coil around the vagus nerve. And then it connects to a battery pack that it's kind of similar to the battery pack that people that have pacemakers might wear. So we can tuck that battery pack under the skin of the chest, very close to where we put the vagal nerve stimulator. Or for sometimes, depending on our patient, if it works better for cosmetic reasons, for us to tuck that battery pack just under the axilla, which is the armpit, just a little bit lower than that on the side of the chest, we may tuck that battery pack there. And then with the help of our neurologists, we program that stimulator to stimulate the vagus nerve. Now, why do we do that? Well, in our current level of understanding, the stimulation of that vagus nerve results in what appears to be a very, very powerful stream of effects that does the following. Vagus nerve energy floods the brain. And then in our body's constant balancing act, seeing all this vagus nerve energy, it then gives the opposite energy in the brain, the equivalence of adrenaline energy. So it sees the vagus nerve energy, which then gets counterbalanced by the adrenaline energy, which is then counterbalanced with a process that quiets the conversation of the brain down so that seizures are happening less often.
And with the heart, what happens with the heart at that point?
Well, the heart, which gets slowed down with vagus nerve stimulation, one of the first indications that a seizure is happening is an increase in heart rate. Okay.
So this is a heart-brain loop that is very, very much utilitarian.
That's right. So the vagal nerve stimulator will actually, use that heart-brain loop with the increase in heart rate to detect that it seems like a seizure is about to come on, and then it will, in response, stimulate the vagus nerve, which will not only slow the heart down, because it's sending that vagal nerve stimulation to the heart, so it'll slow it down, and then it'll also track up to the brain to start the series of reactions I just described that can actually slow down or stop the seizure from happening altogether. Kind of similar to the way a pacemaker will detect that there is an abnormal rhythm about to start in the heart, and it will interrupt that abnormality.
So by extension, from a mentality point of view, there's ways the heart-brain loop brings about a peace of mind, a peace of heart.
Absolutely. I think what's important for our viewers to understand, Dr. Thomas, is that they don't need to understand all the intricacies of the heart-brain loop, the brain-heart connection, everything we've talked about. I hope they found it interesting and some of it enlightening. The key thing is to know that this loop exists and that they have great power over it. A few simple, consistent actions. And so understand that, not only in terms of acting quickly when there's a threat to health, like a potential heart attack with chest pain, or potential stroke with new weakness, numbness, or loss of the ability to speak, for example. But that by being proactive in exercising consistently, which can be as simple as, first thing I do when I wake up, I'm going to go take a walk. Before I think myself out of taking a walk, just go take a walk.
Exactly.
You don't even need to run. I used to hate running, by the way. And I just started walking because it was easy and I could commit to it. So commit to walking. And then over time, I loved walking. And at some point on one of my walks, I was walking for several months and it was starting to get a little boring. And I thought, I want to spice this up. So let me run a few steps. And then something else started to happen, right?
Sure.
So exercise. Exercise transforms the brain. It transforms the heart and it transforms the brain directly and indirectly. And in all of the ways that we talked about, vascular, endocrinological, and mental emotional, exercise is very powerful medication, as is nutrition. Okay, so exercise and nutrition can heal us and lengthen our lives and heighten the quality of our lives. Mental health and well-being. I only briefly spoke about meditation and hypnosis and the whole realm of taking care of our wellness and our mental health. These are activities that can have transformative and very powerful impacts on our health and well-being, our brain health and our heart health. Regular meditating, finding our preferred tracks of interest on our mentality app, and allowing ourselves to deprogram or reprogram the software in the repository that hurts us without us even realizing it.
Exactly.
Give us some new programming that empowers us to heighten our wellness and our well-being.
Exactly.
Right? These are things that are available for everyone, right? You and I have discussed our array of motivational speakers who have constituted some of the many disciplines you and I have both dabbled in. And we know one of the sayings from one of them has relates to this concept that you don't have to be an electrician to flip the switch and turn on the lights. We can all flip the switch. We can all, right? It's really about flipping the switch and recognizing that you have the power to flip the switch.
Exactly.
And you have the power to turn the lights off as well.
Exactly.
Right. And getting ourselves to understand when what we may be dealing with is failure to recognize that we have the power to turn the switch on or to plug it in or to unplug it, and remembering to do that when we need to optimize our mental, physical, and emotional wellness and health and well-being.
Well, I love the fact that you said that at one point you did not like to run, but do it before you can talk yourself out of it. Don't run from it, run through it.
That's right.
And that way, many of the things that you spoke about today, when the heart-brain connection, heart-brain loop, brain-heart connection, heart-brain loop, also followed up with conversations of prophylactic measures that can be taken by way of good nutrition, good health practices, and also good mental health practices and exercise.
That's right.
So as much as you shared the neurosurgical portion and also the cardiological portion, you all you also subtly and sometimes overtly underscored the benefits of preventing these things with good health and well-being. And the way that you delivered it is masterful.
Thank you.
Appreciate
I appreciate you, Dr. Thomas.
it. Dr. Barthelemy, you are definitely a bright light within side of mentality and globally. And you can't thank you enough for this particular piece. And it was something that I wanted to share with the audience because there's always an argument of what leads the being, the mind or the heart. And by speaking about how the mind and the heart are connected, basically makes the argument move because it's all together. And I couldn't think of a better person to deliver it. And we thank
Well,
you.
this was so much fun for me. I mean, these are, in my clinical practice, in my academic life, my research, both of which are very full and fulfilling.
Mhm.
I don't get to have conversations like this, so this is one of the reasons I love connecting with you when we can, and offering
Yes,
something new, something different, and
yes,
something that supports in a very different way
yes,
from what I do in my day job.
yes. Well, it's very much appreciated, and also there's a level of appreciation for what you shared earlier on in our conversation that um, neurosurgeons are trained, uh, I won't say disproportionately, but mostly in helping to repair and cure uh, issues that come up, as opposed to uh, the wellness piece that avoids the issues from coming up that need to be repaired or cured.
That's right. I have many patients who recognize immediately, or not patients, um, new contacts, colleagues,
Hmm.
friends that I may meet,
Hmm.
um, who catch themselves, wanting to very politely suggest that, oh, they hope they would have the opportunity to be my patient, and then recognizing what that would mean, they catch themselves and quickly say, well, I'm sure you'll understand if I humbly offer that I hope I don't ever have to be your patient. And
Exactly.
and I
Exactly.
would say, and I would offer, I hope the same.
But owing also to your education in physiology, you have a two-fisted, if I may, two-fisted approach to um, neurosurgery and things like that, which um, broadens the scope of approaches that you take to the field, which is beautiful as well.
I appreciate that, Dr. Thomas. And I think, you're the one who helped me recognize that over a, I guess, 19-year journey of training and education, when
Mhm.
oftentimes you don't see where things are going. It's a long
Yes,
time to go through, training and
yes,
education.
yes.
And sometimes, many times on a journey like that, you're not sure how or whether things are going to come together. So I really appreciate um, sitting where I get to sit now with colleagues and friends like yourself, and seeing that indeed there are very powerful opportunities for all of this to come together and be of service to others.
Oh, well, we appreciate you immensely, and congratulations on the new position at Downstate. And you know, wellness. This is another, uh, I guess, another value add to everything that you've done. Like you said, over 19 years, you can speak to neurosurgery, but also to the heart and what's in the center of the fold of the world of wellness as it's now exploding. And those are one of the byproducts, I would think, of the years and years of study and education that we have. And it is very, very important in this day and time. For another conversation, perhaps we'll get into other things that it touches on, like AI and its application, as opposed to the original intelligence.
That's it.
Yes, definitely, definitely. Well, do you want to leave us with any parting words, Dr. Barthelemy?
I do. I think from this nearly 2-hour interaction, we've offered several nuggets that I hope and pray will be useful to our listeners.
Mm-hmm.
And we've talked about the mental, physical, and emotional health.
Mm-hmm.
And it occurred to me as we discussed all of this that there is the unacknowledged spiritual realm in the background.
Mm-hmm.
And as someone who deeply respects the diversity of spiritual traditions that people subscribe to,
Mm-hmm.
and who has always been very curious about all of them, the universal, the esoteric. One thing I have noticed consistently across countries and cultures and populations and the differences in spiritual traditions is all spiritual traditions in their profound humanity offer powerful pathways for taking care of all of these realms that we've spoken to as part of deep spiritual care in addition to practices that nurture one's spiritual life. And I feel it's important. Only once did I mention the example from neurosurgery that reminds us that we are not our brains, even as we have an intimate relationship with them. And so the question and contemplation of, well, if I am not my brain, who am I? It's such a powerful one that I feel our spiritual traditions offer great fodder for us to contemplate and to enhance all of what we get to do to take care of our mental, physical, and emotional health. And so I would encourage our viewers to take care of their spirituality and spiritual life as part of a holistic approach to being the very best they aspire to be, and discovering how to be of most impactful service to this great planet of ours and the people on it.
Beautiful, thank you. Are there any publications or any of your literature that you would like to share with the audience, perhaps?
Sure. I've so many great books, particularly in this space. I've mentioned the emotional intelligence, and Daniel Goleman is a neuroscientist of growing popularity who's written about emotional intelligence. So looking at his books are definitely useful. I very much enjoyed Into the Magic Shop, written by Dr. Jim Doty, who is a neurosurgeon who was transformed by his own experience discovering and learning about mindfulness and meditation, and whose very early education in the space really empowered him to transform his life, both from coming from a very difficult context of poverty and a broken family, etc., transforming his life into that of a very successful neurosurgeon, entrepreneur, thinker, innovator. And then later in his life, losing all of his wealth I believe the number was $80 million or something like that, in some bad decisions and finding himself sort of down and out again. And then re-emerging, having had that experience of mindfulness training that so transformed him early in life, which enabled him to step newly into a contemplation of the difference between living life for himself and for his own purposes. In other words, an achievement-focused life, as opposed to an other-focused life of service, which was the pathway that transformed him into a whole other space of fulfillment and contribution. So he tells that story beautifully in his book, Into the Magic Shop, and definitely nods to that brain heart loop. So that's another book I recommend. And he is also a founder and leader of the Center for Compassion and Altruism Research and Education at Stanford University. And they produce a lot of interesting programs, and I think those are worth looking at, as well as the research that they are producing.
Compassion and altruism is definitely an order for the day. And I did pick the book up on your advisement. Just to
great. That's that grand, though humble hippocampus of yours at work. At work once again. I love it.
That humble button. Dr. Ernest J. Barthelemy, we appreciate you. 1,000 thanks for being I'm going to call a liege lord within the mentality ecosystem and all of the other things you do globally. And we know how precious your time is, and thank you for taking that precious time to spend with the audience and really sharing. And we hope that we'll be able to have some more time with you, your schedule permitting in the future.
My great pleasure. Can't wait to be back.
All right. Thank you. 1,000 thanks.
Thanks, Dr. Thomas. Thanks, everyone. Take care.